Hi, so my name is Alex Pitcher. I'm a consultant cardiologist at the John Radcliffe Hospital. Thank you very much for reading the material that's been provided, and thank you very much for all your support of the Heart Centre over the years. We're here to talk about a project, and I'd like to ask for your help with it. We have been able to use some new technology at the John Radcliffe Heart Centre, which I'd like to show you in a second. It's a handheld echo scan, which is new technology that's got some extra features that we think are going to really help us. And we'd like to get more of this technology to use in the community in Oxfordshire at various locations that we use to deliver closer to home patient assessments. This is an echo machine that has got all the sort of bells and whistles and lots of technical features that can do anything that an echo machine can do. But this technology has recently been miniaturized, and here is the new miniaturized echo scan. And this scanner can do almost everything that the big scanner can do, except perhaps a few specialist features. And it allows us to get really clear images of the heart. It can show us how blood flow works in the heart. And it's also got some really exciting artificial intelligence features which allow novice users to be able to get pictures really clearly with much shorter time to training, so they can get upskilled and train much quicker. And it also allows automatic calculation of things like heart function in a much shorter time than has been possible with historical machines. It's also much cheaper, and it is about 1/6 of the cost of bigger machines, and so it's much more cost efficient for us to buy these handheld machines. We have machines like this to use at the John Radcliffe Hospital, but we are trying to develop a service, and have developed a service, where we see patients much closer to home. So we have patients seen now at the Bicester Community Hospital, Chipping Norton Health Centre, and in fact at about 8 different sites in locations around Oxfordshire, which has a number of advantages. First of all, it's much closer to where patients live. It's more accessible, particularly for older patients or for people who are working. And it also means people don't have to come to the John Radcliffe Hospital, which is a huge advantage. These services are often delivered by GPs who we, the consultants at the John Radcliffe Hospital, have upskilled, trained and support to see relatively low risk and straightforward cases. And our intention is to train those GP cardiologists to use these scans with the AI technology to upskill them, and then we will support them and help them, and can monitor those scans and can review the scans here at the John Radcliffe if they have any uncertainties about it. We really think this is an exciting programme. It's the first time that it's been done in the UK, and we would love your support to try to bring this project to patients. The real advantage for us, the consultants at the John Radcliffe, is that it will allow us to focus on high risk and complex patients who come to the John Radcliffe who need help in emergencies, like patients who are having heart attacks, and we can then deliver rapid care to them when they really need it most. And also it allows us to use these really complicated technologies to give the kind of icing on the cake imaging that is needed in just a small number of patients, where we have very specific questions that need to be answered to help the patient. So we hope to buy 10 of these scanners to use in specialist clinics throughout Oxfordshire, and we would be really grateful for your help. The amount of money that's needed is substantial, but compared to the cost of doing it using the traditional models is very much less. So we'd be incredibly grateful for any support that you can give, and I'm very grateful to you for listening. Thank you very much for everything you've done for us, and hopefully we'll do in the future. Thanks so much.